Hello everyone. My name is LaRhonda Daniels. I'm an infection preventionist at the Memorial Hermann Healthcare System and TMC location. I have a background of a bachelor's degree in biology and my master's degree in public health epidemiology. I also have my certification in infection control and have been in the infection control world since about 2019 as an intern and then full-time employee for Memorial Hermann since 2020. I will be discussing the emerging pathogen Candida auris and how Memorial Hermann TMC has used different efforts and are continuing to improve those efforts to reduce the spread within our system. Candida auris started spreading in the US about 2015, and since then, reported cases have increased tremendously. By 2018, cases have increased to about 318% and is still doubling growth today. This invasive fungus is commonly resistant to antifungal drugs and can be easily spread due to improper cleaning and hand hygiene. Hospitalized patients are most vulnerable as it can spread in healthcare settings and cause outbreaks resulting in severe illness and immunocompromise. Currently, Candida auris are surging within the surrounding communities and our local healthcare facilities. Immediate response is crucial to mitigating the severity of the spread of C. auris within the hospital settings. At TMC, between our first wave in October 2022 and in December of 2022, our second wave between January 2023 and March of 2023, we saw a 240% increase in cases. The goals we took on at the TMC was to reduce those incidences of C. auris exposure cases, increase awareness among clinical teams, and develop guidance on how to handle this population. We also wanted to identify the possibility of Candida auris outbreaks and create a process to recognizing and screening patients with high possibility of colonization. Using the expertise of our chief epidemiologist and the guidance of the CDC, we created guidance for isolation precautions, environmental cleaning, and screening precautions. The CDC has very extensive guidance for possible exposures in which we were able to use all the guidance and modify some of those with based on our hospital capabilities. We used our current C. diff precautions with slight modifications, as this was the base to our isolation guidance. The guidance encouraged bleach use for all surface cleaning, biocool for actively positive patients' rooms, and one-to-one nursing staff. As we established this process, we focused on re-education of proper PPE donning and doffing to improve compliance, clear communication for cleaning responsibilities between unit staff and environmental services, and to avoid gaps in methods of cleaning. If a possible exposure was to occur, surveillance cultures was performed on exposed patients with axillary or groin swabs and urine cultures. Isolation precautions were immediately initiated for all new positive patients. Some of the things that we learned were during the development of this guidance was surveillance cultures were only collected once on possibly exposed patients during the first 3 actively positive C. auris patients we had. We noticed that this may not have provided an accurate identification of severity of potential spreading leading to unknown positive patients not being on proper precautions. Consistent surveillance screening is needed to identify severity of spread, which identified a possible exposure within C. auris. Another lesson we identified was that the process for C. auris exposure surveillance became more difficult to manage due to the manual process and high volumes of cultures to meet the recommendations. We are currently working on a foundation for a new electronic system to have better tracking, record keeping, and accuracy. And our infection control team is currently working with our informatics team to have an automatic screening system upon admission and hopes to have it running by the middle of fall. Again, with these efforts, we can identify colonized patients ahead of time to reduce the chance of these patients becoming septic with C. auris. We also hope to have more accurate data collection and reduction in our lab backlog for faster results and initiating isolation upon admission to reduce spread amongst our hospitals. This is generally the gist of my project. I definitely want to thank Dr. Ostrosky and Valerie. These have been two very important figures for this efforts. They have been very much supportive in everything that we're doing here at Memorial Hermann TMC. And if you have any questions, you can reach me at my email at LaRhonda@memorialhermann.org. Thank you.